Welcome back to the fourth part of Lupus South Africa and Andrea's Gift Foundation's 4-part series of the most asked about topics in support of Lupus Awareness Month, as you know. So the fourth topic we're going to be talking about is the joints and muscles. So muscles and joints disease is very common in lupus and will affect most people at some point during their illness. There are several different causes of muscle and joint diseases. So let's jump into it. How does lupus affect the joints and muscles? Active lupus frequently causes joint and tendon inflammation. This usually affects the joints of the hands, although other joints may also be affected. As well as pain, there may be joint swelling and stiffness, particularly at the beginning of the day. Joint flares can occur as part of a more widespread flare involving other parts of the body. Unlike rheumatoid arthritis, the arthritis of lupus does not usually cause joint damage over time, although the tendons may be damaged. Tendon damage might cause some changes in the appearance of the hands. Muscle inflammation due to active lupus, known as myositis, is less common. When it occurs, it causes weakness centered around the shoulders, upper legs, and hips. This can lead to problems with activities such as lifting, walking upstairs, standing up and running. Muscle pain is unusual but may occur. In addition to blood tests, electrical tests, scans of the muscles, and sometimes a muscle biopsy may be required to confirm the diagnosis. So, how are lupus flares of joints and muscles treated? Painkillers such as paracetamol and codeine may be helpful for symptoms of pain. Non-steroidal anti-inflammatory, which is also NSAID, tablets such as ibuprofen can also be helpful in the short term for the symptoms of pain and stiffness. However, they should be avoided if you have had stomach ulcers or lupus nephritis, which is lupus of the kidneys, as we discussed in part 2. You should not take NSAIDs if you are on blood thinners. Please take very big note of that. However, to treat the underlying problem, immunosuppression is usually needed. The choice of immunosuppressant will depend on what other parts of your body are affected by your lupus. Steroid treatment is effective for joint inflammation and works quickly within a few days, but due to the potential side effects, your doctor will want to keep the dose to a minimum. Hydroxychloroquine is commonly used and takes approximately 3 months to take effect. Sometimes stronger agents such as methotrexate, azathioprine, and rituximab are needed. These again take around 3 months to fully take effect. Physical therapy for the hands may help. Treatment for muscle inflammation will usually require steroid therapy. Unlike the joint disease, it will usually take a few weeks before you feel some improvement in your systems, and higher doses of steroid may be needed. Immunosuppressants such as mycophenolate and azathioprine are usually required and take around 3 months to take effect. Exercise is helpful in building up muscle strength and should be started even when the muscle disease is active. Your doctor may refer you to a physiotherapist for this. So what problems may arise due to damage from previous flares? Tendon damage due to previous disease may create joint instability and deformities. This may cause pain and difficulty with some hand movements. In addition to some lupus patients also have rheumatoid arthritis with joint damage, causing reduced joint movement and pain. It is important to check that there is no ongoing active disease causing further damage. However, even when your lupus is well controlled, these pains can persist. Although a rare side effect, the blood supply to bones may be disturbed in lupus, particularly during high-dose steroid therapy. The most frequently affected joint is the hip, although other joints such as the knees and shoulders can also be affected. The main symptom is pain, which worsens when moving the joint. The changes may show up on an X-ray if advanced, but usually an MRI is required. Steroid therapy may cause thinning of the bones, known as osteoporosis. This does not cause pain in itself but increases the risk of bone breakage. If you are likely to be on steroid treatment for more than a few weeks, your doctor will prescribe medications to help prevent osteoporosis. Calcium and vitamin D supplements are usually prescribed, and if your risk of osteoporosis is high enough, a group of drugs called bisphosphonates, most commonly alendronate, may also be recommended. It is possible to make lifestyle changes to reduce your risk of osteoporosis. This includes keeping a balanced diet, maintaining a healthy weight, participating in regular weight bearing or resistance training exercise, stopping smoking, and limiting alcohol intake. How are problems due to damage treated? For pain from joint and tendon damage, your doctor may refer you for physiotherapy or hand therapy. Exercises can strengthen the muscle supporting the joint and encourage joint remodeling. Your physiotherapist may also supply splints to support the joint. Painkillers may be required, and in certain situations, surgery on the tendons or joint replacement surgery can be very effective. Osteoporosis is usually treated with a group of drugs called bisphosphonates, most commonly alendronate, which is taken weekly. How can fibromyalgia be treated? Increased treatment of the underlying lupus with immunosuppressants has no effect on fibromyalgia. Physiotherapy with an exercise program aimed at a gradual increase in exercise and activity may be beneficial. Psychological treatments such as cognitive behavioral therapy, which is also known as CBT, are aimed at helping people find ways of coping better with the pain of fibromyalgia. Many patients may not benefit from drug treatment and may experience more relief from treatments such as physiotherapy and cognitive behavior therapy, CBT. However, certain drugs such as amitriptyline and duloxetine, which are also used for depression, and gabapentin and pregabalin, which are also used for nerve pain, may help ease the pain. It can take a few weeks for the benefits to be felt. Some people have trouble with some side effects such as dizziness, drowsiness, and weight gain with these drugs, and need to try several different ones to find one that is right for them. Can exercise help with joint and muscle pain? Gentle exercise can help people with lupus build stronger muscles, prevent joint stiffness, control fatigue, and avoid weight gain. Low impact exercises, which involve stretching, can reduce stiffness and make limbs more mobile. Resistance training or weightlifting works muscles and will contribute to better joint support. Aerobic exercise such as dancing, water exercising, cycling, or walking that uses the body's large muscles also improves heart and lung function. Yoga, Pilates, and Tai Chi can help with posture, balance, and coordination, all of which are important when managing lupus. Remember to take it slow when starting any exercise routine and increase your level of intensity when it only feels right. Exercising regularly at a lower intensity will be more beneficial than exercising only occasionally at a high level of intensity. Keep a steady pace and remember to rest between sessions. It is important to consult your doctor before commencing any exercise, as some movements can be harmful when you have swollen joints or muscle pain. Thank you so much for listening to our last episode of our 4-part series of the most asked about topics. Please share these videos to your friends and family or to other lupus warriors to help spread awareness this Lupus Awareness Month. Thank you.